Okay, we're ready to begin, Mayor. Go ahead.
Okay, thank you. Well, good morning, and thank you everybody for joining us today. I want to welcome as well.
It has changed this morning. The doors opened at 9 a.m. So basically, anyone who
Okay, sorry about that. I think that was CP24. So whoever is on the CP24 team, just make sure you're muted the whole time. Thank you. Okay, go ahead.
Okay, yeah, we'll start again. Good morning, and thank you very much for joining us today. And I'm very happy to be with the hardworking chair of the Infrastructure and Environment Committee, Councillor Jennifer McKelvey. And just as to encourage more hot weather to come our way, we're here to talk about snow. But as I mentioned this morning when I was talking about these things on television, we have to plan ahead and we have to make decisions about things that are going to happen because winter does follow fall, and fall follows summer, and we're almost at the summer. So it is never too early to talk about snow. And in 2019, this all started back then. And in the wake of a large snowstorm in which there were several issues that arose, I wrote a letter to the city staff asking them to take a long, hard look, a careful look at winter services generally, and how they're delivered to the people of the city of Toronto, and whether or not, one of the questions that was there was whether or not we could expand sidewalk snow clearing. Around 85% of our sidewalks across the city, and there are some 6,070 kilometers, are cleared presently by mechanical plows all winter. While 15%, which is around 1,230 kilometers of sidewalks, were not cleared due to the sidewalks being narrow and due to the then available equipment being too wide for those narrow sidewalks, which had various obstructions that stood in the way of those larger pieces of equipment. While most people pitch in and do their part to clear the sidewalks, we're grateful for that. There are plenty of examples each year where public sidewalks become virtually inaccessible for people walking, for people in wheelchairs, or people pushing a stroller, just people trying to get around in the winter. So staff came forward with a pilot project to stretch over 2 winter seasons to see if we could use new equipment. City staff discovered new machines at the American Public Works Association Snow Conference in Salt Lake City in May of 2019. In order to clear these narrower sidewalks. But before we obviously placed a large order for such equipment, it was important to see how much of the problem would solve, if in fact it would solve the problem, and so on. Hence, the pilot projects spread over different areas of the city over the 2 winter period. So the 2-year pilot project wrapped up when the snow melted this spring. Thank goodness it did. And I am pleased to report to the people of Toronto that the pilot project was an outstanding success. It showed that these sidewalk plows, these new sidewalk plows with flexible blades and so on, could work on 90% of the 1,231 kilometers of sidewalk. Sorry, let me say that again. It showed that the new plows could work on 90% of the 231 kilometers that were included in the pilot project. And the pilot project in turn was meant to reflect the 1,200 plus kilometers of sidewalk that couldn't be presently cleared by the equipment that had been in use in prior years. The 10% where the new equipment wouldn't work and couldn't work includes sidewalks with utility poles in the middle, for example. It includes other sidewalks where retaining walls are on a front yard, and that is on the other side of the sidewalk up against street parking, and that the space in between just isn't such that the plows can get up and down those particular sidewalks, so that even the smaller plows don't have room to plow on those sidewalks. A study of all the sidewalks where we don't clear snow confirmed that the mechanical clearing would work on 91% of all of the sidewalks, with just over 100 kilometers then left to be cleared by hand, as it were. So here we are today with a report that will be going to the Infrastructure and Environment Committee under the chairmanship of Councillor McKelvey, and that report concludes the following. First of all, the pilot worked. Secondly, this equipment will work to get the snow and ice cleared on the vast majority of sidewalks across the city that are presently not covered by city mechanical snow clearing. Thirdly, the cost to do this, to expand the sidewalk snow clearing done by the city through mechanical means to those areas of the city not presently covered, is lower than had originally been estimated. It's about $4 million on the operating side. That is millions less than the original estimate, thanks to now available new equipment and the real on-the-ground experience we have from the last 2 years during the pilot project. The report therefore concludes that we are able to deploy mechanical snow removal to all city sidewalks with very, very limited exceptions across the city this winter, coming winter, and that is a recommendation that I will support. This is great news for the people of the City of Toronto and for the rest of the City of Toronto who have not historically enjoyed the mechanical sidewalk snow clearing done by the city during the winter months. And I want to thank the city staff first and foremost for all the work that they have done to make sure we got this right, and that we made sure we had the right equipment in the right places, and that we found out, quite frankly, where we couldn't do this, and that we're in the process of making arrangements to look after those sections, those limited sections of the city. This will mean that when the snow starts to fall, as much as it's going to happen, and we may not like to think about it now, in this fall, 7,300 kilometers of sidewalk in the city will be cleared by the city, and that's all 7,300 kilometers, a very limited number being done by hand and methods like that, but most of it now done by mechanical means. This will mean 103,626 households will now receive this service, including 91%, which would now receive mechanical sidewalk snow clearing. Around 9% will be manually cleared due to the sidewalk obstructions. And the way that's handled, I asked about it last week, by the way, is that, for example, as you go around with these small plows, there are trucks that have to go with them to replenish the salt dispenser that's in the back of these small plows. And those trucks will have personnel on them that can, in a given stretch where the small plow can't operate, will clear the sidewalk by hand. This will be a good service that we will provide to every resident, and it came about in the right and responsible way. And I'm glad that we stayed the course. I'm glad that we took the time and did the careful work necessary to prove out what could be done and what couldn't be done, and then came up with an answer as to how to deal with what could not be done in terms of equipment that can do the vast majority of this, but finding an answer for those places where that equipment can't do the job. And it allows us to move forward in an efficient manner with the outstanding questions largely answered, and I'm told the equipment in hand by the time of the next winter. So I believe this is a very solid step forward for the City of Toronto, and I am confident that my council colleagues, starting with Councillor McKelvey's committee, will approve this and move forward with it in plenty of time for next winter. And so I thank you, and on that note, I will introduce who I said earlier on was indeed the very hardworking chair of the Infrastructure and Environment Committee, Councillor McKelvey.
Good morning. Thank you, Mayor Tory. I know the last thing people want to think about is snow in May, but I'm always very happy to discuss real actions that could help improve accessibility and mobility in our city, as I know Mayor Tory is as well. Thank you, Mayor Tory, for challenging our very capable city staff to find ways to make improvements to how our winter services are delivered. And thanks to your leadership, an additional 1,300 kilometers of sidewalk will be cleared this year. Toronto is a winter city, and it's clear that when it snows, it can be difficult for many people who live, work, and visit Toronto to get to where they need to go because of our sidewalks. The Winter Services Program has always been about ensuring the safety of residents, whether you're out walking, using a mobility device, driving, or cycling. It's not just about safety, though. Equity of service delivery and accessibility must be important priorities when we're talking about movement and mobility during the snowiest and coldest of months. Sidewalks are public spaces that connect people to transit, to park spaces, and to other opportunities, and must be safe and available as soon as possible after it snows. I look forward to discussing this report further at the next meeting of the Infrastructure and Environment Committee, and I encourage residents to have their say on this important issue by submitting their comments in advance or requesting to speak at the meeting. And again, thank you, Mayor Tory, for challenging city staff to come up with a plan for this in a very thoughtful and methodological way. And I think we have a great solution here, and I'm hopeful all our colleagues will support it.
Thank you, Councillor McKelvey and Mayor Tory. We will now begin the media Q&A. As a reminder, it's one question, one follow-up, and if you, when we do call your name, please unmute yourself. So first up, we have Elena DeLuigi from Globe and Mail. I'm not sure, Elena, if you have any questions.
Yeah, I just wanted to know how this rollout will look in the coming months, well, in the winter.
Well, we have to. I'll turn to our city works staff for comment in a moment. But obviously, we have to get the approval to acquire the additional equipment because we need more of these very excellent small plows. And I hope you have a chance to look at some of the videos that show those plows at work. And it also shows instances in which they just can't do their work because the sidewalks in question with utility poles and retaining walls and such are sometimes too narrow. But we've got to acquire the equipment, which I understand is available, and there's a capital cost of that of about $5.5 million. And then we simply have to have a plan, which I know the city staff are working hard to have in place. And because we did the pilot, we know, what is required in order to roll this out to the remaining areas. We did pilot in hundreds of kilometers of sidewalk. And so that is why we can say with assurance that it can be done in time for next winter. And on that note, maybe I'll turn it over to city staff who can just elaborate if there's any elaboration on the detail of the plan that's being worked on.
Thank you, Mr. Mayor. Hello, everyone. Yeah, so as the mayor indicated, in addition to the procurement of the equipment, we'll be mobilizing staff over the summer in partnership with other city divisions, and we'll have training for our staff. So literally over the summer months, we'll be doing dry runs for our staff so they become familiar with the areas, with the neighborhoods, with the routes. And then as the equipment is delivered, we'll provide practical training for the staff, and we hope to be up and running for this winter season.
And Elena, may I just add, just because Vincent spoke and I had a chance to get a briefing late last week from him on this, and may I just say that they've done a very thorough job on this so that they've even thought about training the staff and doing all those kinds of things. How they'll train staff to plow snow in the winter, I don't know, but I'm sure it's really just about working the equipment. But they've thought about this. And this is one of the reasons why this had to be done properly. I point out that there are many, many cities still in this country and in the United States that don't do this at all. And we have now found a way to do the rest of the city that we were doing most of before. And I commend the staff for coming up with the right equipment, the right plan, the right training they're going to do this summer to do this in the whole of the city. And I'm proud of that. But we did it the right way, which is not through grandstanding and all that sort of thing. It is through the hard work of doing a pilot project and answering all the questions that need to be answered.
Do you have a follow-up?
Yeah, I just wanted to ask the 9% that would have to do that would have to be done manually. Is that that's for the residents to do? Am I correct in saying that?
I will start by saying that I said in my remarks, and I'll ask Vincent to comment, that since we're adopting the principle now that the city will look after all snow clearing, and we already had a substantial number of people who were people with differing abilities and other seniors who had snow clearing done for them by the city. But since the principle is now being extended that everyone will have their snow cleared and that the vast majority will have that done mechanically, I think, as I pointed out, there will be these trucks and other ways of getting people around to do the sidewalks that can't be done mechanically, such that every city resident through any of these programs will have their snow cleared. And Vincent, I want to make sure I'm correct in that and that you may want to add to that.
Hello, Mr. Mayor. Yes, you are correct. In addition to that, there were certain encroachments that we found where working with the resident, we believe we'll be able to resolve those encroachment issues and be able to provide mechanical clearing, such as overgrown shrubbery. Perhaps there's a signpost that we'll be able to move to allow the machine, the plows, to navigate through that area. So of the 9%, we will continue to look at solutions to ensure that those areas can provide mechanical clearing. But for those that can't, we will provide manual clearing.
Okay, thank you. Next up, we have David Ryder from the Star. Go ahead, David.
Hi, everybody. When I've covered over the years, when I've many city hall debates where there's been talk where suburban councillors have talked about all the things downtown councillors get, and downtown councillors say, well, what about downtown snow clearing and also leaf collection? So I'll ask if that's the other remaining thing that some suburban Toronto's people get that downtown ones don't. Is there any talk about also looking at the leaf collection issue that is provided now, I believe in maybe at Etobicoke and Scarborough?
I will be perfectly straightforward in saying that that comes up for discussion every single year. I've now had 6 budgets that I've been responsible for together with Councillor Crawford, and every single year the matter of leaf collection comes up. And it is dealt with, as are many things that people would like to have in the city that we would love to be able to do for them. But I have been committed, of course, to making sure that we are fair to people across the city, but we also make sure we're fair to them by keeping their taxes, manageable for them. And so I'm sure it'll come up again next year, and I'm sure that maybe that debate will be complicated by the fact that now the snow clearing issue is no longer an issue, but we'll take that issue up when it comes up.
Thank you. My follow-up is on the issue of vaccine, and that's for Mayor Tory. Mayor Tory, on Friday when I talked to Chief Pegg about the pretty dramatic 40% drop in supply for Toronto because of the end of the provincial top-up for hotspots, that was when we were thinking that the eligibility for vaccines might go down to 30+ this week. And he said that because the city only books appointments for which it has vaccine, there might be people who want to book at a city clinic who just might not be able to because the spots are pretty booked up for the next few weeks. Now that it's going down to 18+, which seems to have been unexpected by most people, including him, are you concerned that people will be told they're eligible, but then simply not be able to book a vaccine appointment?
This is a concern that I expressed last week. Because I made it clear that we had all kinds of unused capacity that we put in place from the beginning, but that we can only utilize that capacity if we have the vaccine. And so the answer to the question is yes, it is a concern that there's demand being added each and every day, sometimes with more consultation than others, and that there's only so much vaccine to go around. And we have less vaccine, for example, this week than we had last week. And there's an explanation for that. But bottom line, we're going to have to look at all of this very carefully and figure out how we as a city can continue to do what we are determined to do, which is to address hotspots, but also to address those who may not live in hotspots who've now been made eligible and will be seeking an appointment. And, we can't make appointments available for which we don't have vaccine. That people will understand that. They certainly don't want to make an appointment and then find we cancel it because we're not in possession of the vaccine. So supply continues to be an issue for us, and we're going to be examining the implications of the provincial announcement. We welcome opening this up to as many people as we possibly can. We want everybody to get vaccinated. We want kids that are between 12 and 18 to be able to get vaccinated with their families if that's possible. But again, the province also controls the supply. And so we have to make sure that, the left hand and the right hand know what each other are doing here. And that's something we'll be taking up with ourselves and with the province as we go into today. This is all news, of course.
Okay, thank you. Next up, we have Matt Bingley from Global. Go ahead.
Hi, back over to snow clearing. I just wanted to note that when we were looking at the pilot this winter, the first year, I think it was deemed that there was too little amount of snow, not enough snow falling to really get a clear picture of it. This winter, depending on who you ask, there wasn't as much snow again, and I'm wondering if that perhaps skewed the results at all.
Vincent, I'll turn that over to you.
Good morning. Yeah, thank you for the question. Absolutely not. We actually got quite a bit of snowfall in January and February to truly test the machines. In fact, on one particular snow event, we had up to 15 centimeters of snowfall in the trial areas. So we were able to test the machines to the point where we are satisfied that they can operate under all winter conditions and within the different neighborhoods. So the number of events and the sample size was sufficient for us to get a good idea of how these machines can work.
I'll just add to that, Matt. I'm very glad we took the 2 winters, given that there wasn't a huge amount of snow in either one relative to some of those heavy snow winters we've had in the past. But I'm glad we took the 2 winters, that we did this properly, that we really kind of tried to cross the T's and dot the I's in terms of making sure of how we would deal with those sidewalks that were not accessible to the new equipment, and that we made sure the new equipment, the new style equipment worked, and all of those things. Because I was under quite a lot of pressure to, suddenly announce we were going to have some kind of a makeshift arrangement to make this happen, which is something that I always wanted to see happen if we could. But I'm glad we did it properly and responsibly, and we're going to be in the right place, assuming the committee and the council approves of this. And it is something that is affordable for us to do as well within the context of fairness and safety for people.
And when you talk about the expansion likely going, even with that about the 100 kilometers of snow with obstructions on sidewalks, how do you sort of how does the conversation shift with the public over the responsibility they have to play with removing their own snow in a timely manner to sort of help the city out of the areas that traditionally would have had snow clearing, or no snow clearing,
Well,
rather?
there's a lot of people out there who've even said to me in discussing this issue that they would continue to plow their own sidewalk or to shovel their own sidewalk in front of their house anyways. While they're at it, they just get out and do that because they're doing that for their neighbors and for themselves. But the bottom line is the city will now be able to say to all residents across the city that mostly mechanically, but otherwise manually, we will clear your snow. And many seniors and people with differing abilities had that before, even in the areas where we didn't do it mechanically. But, you know, obviously we're still most eagerly accepting of the efforts that individual Torontonians want to make to clear snow earlier, because we can't be at every sidewalk at the first moment of a snowfall. And so I'm sure people will continue to do that. But the bottom line is now every Toronto resident will be able to count on mechanical or manual clearing, mostly mechanical, across the city. And I think that's a desired state, that everybody should be treated the same way.
Okay, and then Momin, do you have any questions? If so, unmute yourself and go ahead.
Yes, I do. Good morning. Thank you so much for taking my question. I just wanted to follow up on David's question about vaccine supply. Mayor Tory, just if you could tell us where we are at with in terms of how much supply we have, and do your supply concerns apply to just the mass vaccination clinics, or does it also apply to all those mobile and pop-up clinics we're seeing around the city as well?
We're told in advance of a given week how much supply we're going to have. And so we saw a chart this morning that indicated that we've allocated, for example, 60,000 doses to the city run clinics. And then the remainder of what I think is a total of 179,000 doses are allocated across all the hospital partners and to the Operation Sprint, which is our effort to go into the hottest of hot postal codes and deal with the vaccination there. The point I'm making is that that supply was known to us in advance. It was less than we received last week because of the over allocation that was done to allow us to address the hottest of hotspots in a very intensive way, which was very successful and which we urged the government to continue with, but they didn't, and that's their decision. Now, what I'm saying though is that we're seeing the demand increase by making a change, which had been contemplated. They certainly mentioned that they might do this, although we thought it was going to be a little later in coming. As they increase demand, we're simply saying, would they please also in parallel consider that as they increase demand, if they don't increase supply, we're not able to accommodate people in appointments. So you create this situation where people hear the news, you know, great news that my age group, my particular area of town can now get vaccinated, except they get disappointed when they turn to those who are actually in a position to put the needles in the arms, namely in our case, the City of Toronto and our health partners, and find that vaccine has not been increased accordingly. And so we will obviously have to review all these numbers in light of this announcement that came at 8 o'clock this morning. But I think it will simply cause us to reiterate to the province, respectfully, that if we're going to really attack this where it still is a continuing challenge of an acute nature in the City of Toronto, Peel, and hotspots like that, that the vaccine should go with the increased demand that they're creating.
Okay, just to follow up to that then, if we're dropping to 18 tomorrow, should people pump the brakes and wait, or should they just go ahead? And do you have a number in mind of vaccines you'd like to see, or is it just as many as you can get?
Well, I think you could do the math, and we haven't even done it ourselves yet. We're going to be reviewing the math as to how many people effectively were added to the roster of those who could be eligible to get vaccinated today. And don't get me wrong, I want all of those at the first possible moment. But you then have to look at the part that goes with it in parallel, which is the obligation we have to make sure there is a place across the spectrum, city clinics, health partner clinics, mobile clinics that we're doing in the Sprint operation, and make sure there's the vaccine available. And so I would not say to people they should wait, but they should make sure they cover all of the different avenues. And this is where it gets a bit confusing for them, and we're trying not to make it confusing for them. They should try pharmacies. I gather there's going to be an expansion in the number of pharmacies. They should try the hospital-run clinics, which are accessed through the vaccine TO, and they should try the provincial registration system that we're on for the city clinics, because all of those will have some capacity. But I think it's fairly clear that the capacity in terms of vaccine availability, not the capacity of our clinics, but the capacity of vaccine availability, will likely not match the number of people seeking to get a vaccination. And we've made that point publicly to you and to the province. And those are all points that are under very active discussion and certainly consideration by us as how to make sure we can vaccinate as many people as we can, given the supply we've got.
Okay, that's it for today. That was the last question. Thanks, everybody. Have a great week.
Thank you. Thanks, Jennifer. Bye.